Yay, we're live.
Yes, welcome back to our Thursdays COVID-19 chat IG Lives.
Yeah. Should we kick it off already, or should we wait a little bit?
Yeah, let's just wait a little bit.
Okay,
You already know the drill. We'll wait
Yeah.
a teensy bit to let some followers in.
Sure.
Let an Instagram do its thing.
Yeah. How's your Thursday morning going?
It's going well.
Yeah?
Yeah.
Woke up with some energy?
I did. Woke up with some energy. I think I slept well last night. That made a big difference.
Oh, yeah, no, that'll do it.
Yeah.
Do you have AC in your house?
I don't, but it wasn't as hot as I thought it was going to be. So I was like,
You're
I'm
right,
fine.
It's been cooling down a little bit.
Thank goodness.
I know. There were some rough days that I was like, I don't want to do this anymore.
Yeah. Oh my gosh, yes. Oh, hello. Hi, COVID-free SD.
Hi.
Thanks for coming. We're just doing a little check-in. How was your morning?
Our eternal supporters.
Yes. Shout out to COVIDfree.sd.
Yeah, absolutely. I'm happy to see these connections between different organizations happening. I think that's been the most exciting part of being a community health worker, is just seeing how different parts of the community and different organizations are coming together to exchange resources
and all towards the same goal.
Yeah.
All right. Ooh, coffee. Coffee's great.
Yes.
Love that. Ooh, might need some after this.
I know. I had an emergency one. So I was doing cold calls in the morning, and then I was like,
it's coming
I know. I did not sleep as well as you did,
Aww.
so I had to run down to the store and get me one of these little cold brews with the oat milk, you know?
Yes, oat
milk.
milk.
Little creamy.
You like that?
Yeah, it was yummy.
All right, I guess we can just go ahead and get started.
Sure. So my name is Julian. I'm a community health worker with the Vaccine Outreach Program. My pronouns are they, them, and we're going to have a little chat about COVID testing today.
Yes. Hi everyone, my name is Krystle Diaz, also a community health worker. My pronouns are she and her.
Yeah, and so in case you're tuning in for the first time or you're watching this video for the first time, we are the Vaccine Outreach Program, and we help folks in San Diego kind of eliminate the barriers of getting access to the vaccine or to COVID tests. And that comes in the form of making the appointment for you, providing translation services, providing transportation, and just
assisting in your language.
Yeah, assisting in your language, and just being able to take you to the appointment or meet you at the appointment, just in case you need any help navigating those systems, as they can be kind of intimidating sometimes. And so today we're going to be talking about our COVID-19 testing experiences more recently.
Yes.
So if you want to go ahead and let me know, because you got tested recently, right?
Yes.
Yeah.
So I got tested last Friday. It was mainly because I had this tingly sensation in my nose, and it wasn't super stand out.
My eyes are like, what?
It was just enough to be it isn't always like that, but it would come and go, right?
Yeah.
It would just kind of bother. And the week before, I did go out to dinner, and it was a bit busy, so I was like, you know what? I'll just get tested, because there are plenty of testing sites around, and it doesn't hurt to be safe.
Yeah.
So I wanted something same day, so I just went onto Google and I looked up San Diego County testing COVID-19 sites, and the county site came up, and it was pretty easy to navigate. I was able to filter it either by location or by day, and so I did by day, and I was just looking at areas that were open past I think it was 5 o'clock at the time, because I got off work.
Yeah.
And luckily I found a place that was open until 7, so I was like, oh great, it works for folks that are working, or if you have school and you're out late, there's sites out there. And this one was a walk-up site, and it didn't require any appointments. There were some sites that required you to schedule an appointment prior, and then some sites where you could drive up. But this one was just a walk-in clinic. Scheduling appointment was recommended, but not necessarily needed for this appointment. or for this site. So I was like, perfect. And it was only about 4 miles away from my house. So I'm glad that there are lots of different options around.
So it was like a clinic, like you went inside?
Yes.
Somewhere?
Well, actually, it was at a Boys and Girls Center.
Okay.
Yeah, so when I got there, there was a line for folks that had an appointment scheduled already, and then a line for those that didn't, and it wasn't too bad. And I think I waited in line for maybe 5 minutes, and all I did in line was fill out like a form on the website. All I had to put in was my name, address, contact information, if I've been vaccinated before, if I was showing any sort of COVID-19 symptoms.
Yeah.
I believe that was it. And then at the end of the process, I got a patient ID. And once I got checked in, like when it was my turn, I just gave the county people at the counter my patient ID. They sent me over to get the swab test done, and it was really quick. The lady was just like, oh, have you gotten tested before? I was like, I have, last year. And she was like, okay, well, I just wanted to let you know that this time all we're going to do is just swab up to like the very tip of your nose.
Yeah.
I was like, okay. And so she got the Q-tip, just went in the swab this way about 10 seconds. Same Q-tip, went in this way about 10 seconds. And she was like, all right, you're all done, and you should get your results by tomorrow afternoon.
Super
like,
quick.
Really quick.
All right.
Really quick, really fluid. There weren't boundaries for me on my end, which was great. And my results did come in about, I want to say 3 o'clock the next day. So it was very fast. Very
was the line, was there like a big line for you to
There actually wasn't.
Okay.
I want to say possibly maybe 5 people. That's including folks that had the appointment scheduled, but it went by very quickly.
Okay.
Yeah.
And what time did you say you went?
I think at this point it was probably around 6.
Okay. So when people are getting off of work and, you know, I would have expected it to be a little busier at that point. So I think there's just so many vaccination and testing sites in different areas that like there's no like conglomeration of people there. Yeah. And that was the same experience for me. So I went to a site that
Hi, thanks for joining.
Thank you for joining us. We're just talking about our recent COVID test experiences. So
oh wait, do you mind if I add on to that?
No, go ahead.
To conclude my testing experience, it did come back. It came back negative.
So sorry, I'm just like,
no, it's okay.
Anyway.
I skipped my mind.
Cool, okay, so Krystle's negative. I'm good. We're good. I went to a site that is right along my commute from my place to the UPAC office here in Golden Hill. And I live in Logan, so I'm not very far. And I happened to see it there, and I stopped to talk to them last week because I figured we could collaborate and kind of direct people towards their site. And it was an open site. It's on 28th. It's the parking lot of the Total Deliverance Church, I believe, and they have another site in Encanto. And they do COVID tests as well as vaccine, and it's all walk-up. So you don't need an appointment. You don't really need to do much but like be there. So I decided to stop by after work because that day I had been reading about the Delta variant and its transmissibility, and even though I'm vaccinated and everybody around me is vaccinated, I thought it might be a good idea to get back into the practice of getting tested regularly, as we are seeing some of these breakthrough cases in vaccinated folks. So I decided to stop by just because I also hadn't gotten tested in like a year probably, or I got vaccinated back in February, so I mean I feel like before that it had been a while since I got tested because I wasn't doing anything.
Chilling at home.
Yeah, just chilling at home, Netflixing. So I went in, they were kind of wrapping up, but they decided to let me take the test anyway.
Nice.
And so I did have to go to a website and like register for them.
Delta variant really doing that world
Yeah,
tour.
she is. She's going around. So I had to get out my smartphone and go onto a link and kind of fill out demographic information so that they know, because I think all this probably goes into like a county database, right? And the guy that was there helping me was just like, you can skip the insurance part, because what happens with the testing is that either your insurance gets billed, or if you don't have insurance, they will bill it to the appropriate like federal agencies. So anybody can get it, right? So he was like, just skip the insurance information, let's make this quick. All I need is your phone number. And I'm like, okay, cool, let's do this.
Basically a contact to give you
to give you my results. And so because they are not medical professionals there, they can't do the swab.
I see.
So they gave me the swab to do, and so they said, like the Q-tip, you're not getting, you don't need to do the lobotomy one anymore, where you're like picking your brain and like tapping the back of your skull. It was the lower nose one, 15 seconds on one side, 15 seconds on the other one, and then you put it in the tube with the solution, and then they have it processed. So I was a little bit frantic at the time, and a little because they were like wrapping up, and I actually Krystle's gonna step aside. No, you're good. And I actually accidentally tipped over the tube with the solution in it, and a little bit of it spilled out. So when my test came back, they were inconclusive. So they were texted to me, and it was an easy link to follow. They were inconclusive because of me tipping over that vial with the solution. Hi, Dominic.
Special guest. We have our program coordinator, Dominic.
Yeah, so we're gonna have them pop in. Do you want to sit here?
Sure.
Yeah, go for it. Yeah.
Okay, so I was like watching along with this video, and I was like, ooh, I want to share my story too of getting tested just for variety.
Yes.
I didn't mean to interrupt though.
No,
are you done with your story?
I'm done.
Okay.
I'm done talking today.
Well, thank you both for like sharing your experiences of getting tested. Yeah, because I just feel like maybe it's not something everybody really talks about, and everyone's experience with like going to different testing sites is like different. So yeah, just also real quick to add in, I also got tested for COVID recently because over the weekend before I went, I was participating in an in-person event where there was like over 100 people. It was indoors, but there was a big ceiling and masks were required. However, not everybody was like consistently wearing them, and some folks were like eating inside, and so just because I was like within 6 feet of a lot of people, I just wanted to like test myself. So 2 or 3 days afterwards, which is probably more likely, like if I had caught anything on that day, like test results might be more likely to be positive rather than like immediately afterward, in case anything had started to incubate, right? And so I went over to the Tubman Chavez Center, which is on 415 Euclid Avenue, I think. Was that the zip code is like 92114, because I used the county website, and there's that interactive map where I just put in my location, and then it shows you all the local locations closest to you, and the hours that they're open, and like other contact info. And so I was like, sweet, it's 5. And they close at 5:30, so I'm gonna head over there real quick. Hopefully it's not too rude, like, shopping at a store, ordering something 5 minutes before the kitchen closes. I didn't want to be like that, but the place was still open, and there was actually still a lot of people there, and they had it set up so that it was like fast triage. Like, they had these giant QR codes. So I pulled out my phone and I took a photo of the thing, and it brought me to a link, and they're like, okay, fill out this form, kind of like what Julian said. And you don't have to answer things that don't have that required red asterisk with it. And it was just really quick. They basically just want like, name, birth date, like identifiable information. And then I also happened to bring my vaccine, the card on it. What do they call it now? The passport. I don't know if that's accurate, but like the dates that I got vaccinated.
Your record.
Yeah, but actually nobody actually asked for that. They just wanted some form of ID, and so I actually just brought a passport too, and they used that to double check with the birth date and the name. And as soon as I was so it was kind of like a theme park too, because as soon as I passed that one table where they gave me the link, there was a line to enter that was kind of like an S form, like a ride to a theme park, and yet it was wide, but I wanted to make sure that while I was in line with other people, I wasn't just 6 feet behind and in front of the people in front of and behind of me, but like in all directions. So like people who had looped around once, there was that one like separator between us, but I still wanted to stay like several feet away, because also in this situation I was like, ooh, this place is full of people who don't know whether they have COVID or not, so it's probably more likely than a different place that I might be exposed if I'm not already. So those are things I was thinking while I was in line. And so as soon as I filled out the form, there was a security guard that was like, if you're done, then come on in, because they were also trying to rush and wrap up the day. And so I went around into the building, and there were also people there like making sure that we were knowing where to go next. And there were cubicles, so I was directed to one of the cubicles, and then that part kind of felt like the DMV a little bit, but it was also really fast. And so the person behind the plexiglass checked my info with my ID, and then they wrote like my name and birth date on a vial, and then they handed it to me, and they're like, okay, now go over here. And so then I went to this different part of the room where there were testers all spaced out and in their full like medical stuff. And the guy that I talked to was really nice. He was like, have you done this before? And I was like, yes. And he said, okay, well, do you want to do it or do you want me to do it? And I was like, okay, well, how far up is it going to go, right? Like, if it's going to go really far up, because it's based on the brand of the test, like whether it's just inside the nostril or like all the way in. And if you wanted to, you could also call ahead to sites that you're planning on going for a test to see what brands they use, and ask questions like that. Or also, if you want to hit us up, we can find out for you, and like, you can bypass a phone call or whatever that way. Just throwing it out there. So it was just inside the nostril, so I was like, all right, that's fine, you can do it. So I held really still. He was really fast, and then afterwards, they used the vial thing that I handed to them, and then they're like, okay, keep an eye out for an email. It might be in your spam folder, but it'll probably come within 24 hours. Although in the building there had been signs everywhere posted saying, oh, your results should take 2 to 4 days. But I actually got it like 2 a.m. the next day, and and the test was taken between 5 and 5:30. So not saying that this is what you should expect necessarily, but in my case, results came faster than what they had prepared me for. So the email was like encrypted, and then so I opened it and I had to do a verification thingy to sign in, and then I got another email with the actual results. And that's how I was able to tell that, thank goodness, I was also negative. So, if folks watching this are not looking forward to getting tested, or they're just seeing it as one big bunch of decisions and navigation they don't want to have to deal with alone, we're here for that. And also, if you know any elders, family members, friends, neighbors who might also be struggling with the logistics of getting a COVID test, please give them our contact info. We'd love to connect with them, especially if there are language barriers. So, okay, didn't mean to interrupt y'all's party.
No, that's fine.
But thanks for letting me pop in and share my experience.
I like that we all had different experiences to share.
Yeah.
So that's neat.
And even that second experience that I described was different from the first time too, because it was at a different place.
Yeah.
It was a drive-through, and I didn't even get out of my car. It kind of felt like a car wash actually. So depending on the place you go, there are drive-through places and then walk-up places. So depending on your preference, that's also a detail that you can find out more about on the county website. Okay, peace.
Thank you, Dominic.
Thank you, Dominic.
Okay. That was great, yes.
Yeah.
So, Julian, with your experience, did you feel any sort of discomfort or pain with the swabbing?
Not at all. 'Cause I got to do it myself, and I mean, it was. I had done the test before earlier on during COVID when they had first become available, just because I was going out. I was like the hunter-gatherer. Like, I would go out and do like the groceries. Me and my partner would go do that because our roommate is immunocompromised. Same reason why I wanted to get tested after reading about Delta. Even though we're all vaccinated, I just want to get back into the habit. But anyway, after having those initial COVID ones where they go like real deep in your, oh my God, that was intense.
I'm glad I didn't get to experience
that was intense, but like, it was just a moment and it was necessary. And now we have these other ones available where it's the lower part of your nose.
Right.
It
may seem scary, I will say, because the Q-tip is kind of big. It's not like the typical one you swab your ears with. Yeah. It's quite large and in charge.
Mine was like a half Q-tip. Like, like, did you get like those large like medical ones? Mine was like a half one. So it just depends on where you go, I guess.
Right.
Yeah.
But even though it was like the larger kind, there was no discomfort. It was just like swabbing your nose.
It's just a little, you don't, there's nothing to it. Like, it's the easiest thing in the world to do. And then you get your results and then you take it from there.
Yeah.
Right? And so, one of the things that I've been doing, because as a community health worker, one of the things that we do is phone banking. So we'll call people and see if they need help with the vaccine, or door knocking, where we do the same thing but like in person and go up to their door. So what I've been doing is scoping out the area, that the area codes the zip code of the places that I'm doing calls at, or just actually going around the neighborhood that I'll be doing door knocking, and I will see if there's any clinics, any CVS's or Rite Aids around there. And then I'll go in and ask for the information and see if they do COVID tests, if they do vaccines, do you need an appointment, do you not, which vaccines are available. And so, that's another option with CVS and Rite Aids. Those are pretty much like everywhere. And so you can give them a call and see if they have and you can see like what the process is to getting those. And I will say that there is a questionnaire on CVS for you to fill out, and the questionnaire will determine whether or not you get the COVID test for free. I know. I was just playing around with that this morning, and so I feel like they're all like yes or no questions, and so basically asking if you've traveled, or if you plan to travel, or if you plan to do something recreational. If you answer yes to that, you're gonna get it for free. So, which I feel like it's like vague enough. Like if you're planning on going out to a restaurant, to me that sounds recreational.
Yeah.
So like if I answer yes to that, then you get it for free. If you answer no to all the questions there, then it'll say that you don't qualify for the free cost one, and so then you have to pay like $139 or something for that. But I think it's like the full test of like antibodies and like all that.
Yes, they do have those.
Yeah, so the way around it is to do like the one that tells you whether or not you got COVID right there and then.
Adding on to that, the county ones, they do have no cost testing appointments. So the one I went to, that was no cost. And again, I just Googled San Diego County COVID-19 testing sites.
Yeah.
So I'm glad you mentioned cost, because I have seen some that do have a price tag to it. I was like, shouldn't these be free? So just be mindful that when you are looking into COVID-19 testing places. But if you would like something that is no cost, again, you can either look up the county website, or you can reach out to us and we can get that done for you.
I feel like the ones that you pay for are like those like the antibody ones, and you would probably find those like at the Rite Aids and the CVS's and these like at these store pharmacy type places. But anywhere else it should be free. The any community clinic, any like pop-up site, anything like that should be free. And usually they also have a person there with like a computer to log in your information if you don't have a phone, to do any of the registration process that you may need. And somebody here Camila Cat had a comment. My 5-year-old sis came back from a COVID test yesterday and said they were digging for boogers. Easy way to make kids brave enough to get tested properly.
Yes, that is such a good way of putting it.
Yeah.
Thank you for sharing that.
That's lovely. I love it. We're just gonna go today to dig for boogers.
Yes.
No big deal. And then like maybe you get a treat afterwards. I don't know. I feel like we should all get a treat after a COVID test and after a vaccine. You know? Yeah. Did you get a treat after you got vaccinated?
I didn't.
You should have.
I should have treated myself.
You can do it today.
I could do it today. Yeah, or even just for getting tested.
Yeah. I think before I got the first vaccine, I went to go get birria.
Oh,
with my partner.
Yes.
We like drove all the way down to San Isidro to
Yes.
get these real specific birria
Yes.
tacos, and then drove all the way back up to Euclid.
No, that's a treat.
If
you're making that commute down there, it's a treat.
Absolutely, yeah, it was great. It was fantastic.
Now, speaking of COVID testing, by looking at the San Diego County website, I'm looking at no appointment test sites available today, here, Thursday. We have 3 locations available. These are all walk-up location sites. Oh, I'm sorry, 4 locations available. All walk-up sites, no appointment necessary. We have one at the Imperial Beach Sports Park Recreation Center. This one is at 425 Imperial Beach Boulevard, 91932. The hours are 7 a.m. to 7 p.m. We have one at the Tubman Chavez Community Center where Dominic got their test done at 415 Euclid Avenue, 92114, 10 a.m. to 5:30 p.m. We have one all the way up in San Marcos. This is at the San Marcos test site at Cal State University San Marcos, at parking lot B on Craven Road. The address is 333 South Twin Oaks Valley Road, 92078. The hours are 10 a.m. to 5:30 p.m. And the last location site we have today for no appointment is at San Isidro, at their San Isidro Civic Center. The address is 212 West Park Avenue, 92173, 7 a.m. to 7 p.m.
Awesome. I think it's important to know where those locations are available that are still open after we get off work, because part of the reason why I spilled my vial was because they were wrapping up and I was like, I don't want to be that person, you know, and I was trying to hurry up, and so now I got to go back and get another test. And that's not going to be inconclusive.
Right. And those sites I listed, they're just the no appointment ones. I figure that may be most convenient for those tuning in right now because it's the day of, but they do have a couple other sites that do require appointment. If you'd like to check those out, you're welcome to check them out on the website. We do have someone, Dom the NB, commented coronavirus-sd.com/testing, and you can check them out there as well.
Absolutely.
Alrighty, Julian, any last comments you'd like to make as we wrap up today's COVID-19 testing discussion?
Just contact us through Instagram, through our UPAC website, through anywhere that you can find our information. If you need help finding a vaccine site, finding a testing site, or any other resources too, we do like very short-term case management as well. So if you need help, finding a phone number for housing assistance, for rental assistance, if you need help finding a phone number for like CalFresh, food stamps, that kind of stuff, give us a call. We got the resources, and maybe sometimes we got a little bit of other additional phone numbers that might get you through the process a little quicker. So let us know if you need any help regarding COVID, as well as any other county services in San Diego that may be needed right now, whether or not it's related to COVID. And that's my spiel for the day.
Yeah. Tying back into COVID-19 testing, you can still get tested even though you are vaccinated. If you should see that you're showing any symptoms, or even if you just feel like you've been out and about to places where there's lots of people around and you just want to get tested for your comfort, I welcome you to do so. There's plenty of sites around. Again, plenty are no cost. The process was fairly quick, and I think it's just nice feeling safe and comforted knowing whether or not you have COVID.
Yeah.
So.
Yeah. Thank you all so much for joining us.
Yeah.
Typically we have these Instagram lives on Thursdays around 11 or 12ish. If there's a time that you think might work better for you, let us know. And then these videos do get posted onto the page.
Yes, the Delta variant is very contagious, and fully vaccinated people can catch it, so it is good to know.
It is, yeah. And again, I want to get back into the habit of getting tested maybe like weekly.
Yeah.
So just to be extra
Same
safe
here.
on that note. So have a wonderful day. Again, let us know if you need any help. If you have any questions, you can contact us at any time. And we'll be off for now.
Yeah. Thanks everyone for joining. See you next week.
Thank you. Bye-bye.
Bye.